So so the three things we can control: amplitude, frequency, pulse, or phase duration. When we look at amplitude, what are we looking at? Amplitude is how much. How much. The best way to sum up amplitude is going to be intensity. So you can write somewhere near amplitude and write intensity. How much or how strong. So how much I feel or how strong I feel it is based on my amplitude. Okay. Okay. So the book tells us that peak amplitude is the maximum current delivered in one phase. So it's how much I'm delivering. It is also one of the three criteria necessary to depolarize a nerve cell. So there are three specific things we need to have in place if we're going to use E-stim to depolarize a nerve cell. One, it needs to be strong enough. Amplitude speaks to, is it strong enough? Remember, if it's too weak, it's going to give us a sub-threshold stimulation, which is not going to be enough to actually cause something to happen. We don't want to be sub-threshold. We want to meet the threshold so that we can actually depolarize that nerve. Okay? All right. Over on the right, it says peak amplitude is measured in current or in milliamps or microamps or in voltage or volts, dealing with voltage. So if I'm using something that deals with current, it's going to be milliamps or milliamps or microamps. If I'm dealing with something that has voltage, it's going to be in volts. Okay. Okay. Peak amplitude, next paragraph, is associated with depth of current penetration. So the highest levels of amplitude can dictate how far in the tissue we're actually feeling the stimulation. Higher amplitudes penetrate deeper into the tissue. Okay. So the higher the amplitude, the closer we are in the actual, the deeper we will be inside of the actual tissue. Okay. So amplitude is the first thing that we have the abilities to adjust. Amplitude. So depending on the stimulator, it's either a knob at the top of the device, it may be a button you click to do it. Each device is different, but they all have the abilities to adjust the amplitude. Okay. Next thing we'll talk about is going to be, hang on. Well, no, let's stay with amplitude. It's giving us some good information. Okay, next page. It says E-stim produces 3 excitatory responses. So the amplitude, turning our amplitude up will give us 3 different responses primarily. One will give us a sensory response. It'll be tingling, vibrating, kind of a superficial feel. That's sensory. Motor is when now I start to get movement out of stimulating that peripheral nerve or stimulating that nerve. Now it's starting to cause active movement to occur. And then finally, the third one is pain. I can turn it up so high that I can start to cause you pain. Mm-hmm. Okay. It says the level of current necessary to excite a nerve fiber is inversely proportional to that diameter. So the larger the nerve, the lower the amount of current you need to depolarize it. So the larger the nerve, the less amplitude needed to depolarize it. Okay. Okay. The book tells us sensory fibers generally fire first. So when we're doing E-stim, the first thing we're going to start to depolarize are sensory nerve fibers. They'll let us know because we'll get sensations of tingling, prickling, and pins and needles. So that's how you know you've depolarized a sensory nerve. It starts to tingle, prickling, very superficial feeling. Sensory fibers are smaller than other fibers, but they're so close to the surface, they're easily stimulated. Okay. Okay. When amplitude is increased rapidly, all nerve fibers will meet thresholds simultaneously. So you won't be able to really ID if your treatment works. If you go up too fast, too high, too strong, you're going to give them a tetanic contraction where the arm locks in, and they're probably never going to come back. Okay. All right, so that's amplitude. How much? How much? The next thing we have the ability to adapt is going to be phase duration. Phase duration. Well, let's jump to frequency. Then we'll come back to phase duration to make it make sense. So jump to 286 and let's talk about frequency. So amplitude is how much, frequency is how often. How often. Okay. So frequency is going to be measured in either pulses per second if we're using pulsed current, or it's going to be measured in hertz if we're using AC current. So if I'm using AC waveform current types, it's going to be measured in hertz. If I'm using pulsatile current, it's going to, then I primarily will be using pulses per second to download, or not download, excuse me. I'll use pulses per second to serve as my documentation strategy. Okay. All righty. So frequency is how often. Now, frequency is really important. For different techniques, I want my frequency really high, somewhere up around 150 pulses per second or 150 hertz. For other things, I want my frequency really low, 10 pulses per second, or 10, well, we don't really do hertz like that low, 10 pulses per second. So it depends on what my treatment goal is for my patient. Okay, so it says frequency is pulses per second. The number of pulses delivered to the body within 1 second. So your body won't discern how many. It'll be something you'll have to look at on the screen or look at when you're doing it, because it's going to happen really fast. Okay. All right. Okay. So it says peak, whereas peak amplitude defines the intensity, frequency defines the quality of the muscle response. Dictating a twitch or tetanic muscle contraction, a twitch indicates that at least one motor unit is responding, producing a non-functional contraction. So you'll see twitch looking like that when we start to set the device. You'll see the arm looking like this. You're like, ooh, something's wrong with my arm. But that's twitch. Non-functional contractions of an area. Okay. All right. A twitch response indicates that at least one motor unit, again, is stimulating, producing non-functional contractions. Okay. And then a tetanic contraction is going to be where it contracts and holds it in place. So it's locking it in place. It does not move. Even if I want to try to move, it pulls me back. It does not allow me to move. That's called a tetanic contraction, or tetany. Fused tetany. Okay. Okay. It says the critical fusion frequency represents the point where twitch converts to tetany. So every person will have a critical fusion point. As we slowly move through some things, it will start to creep, and we'll be able to find what it is. Okay. Impedance or blocking is also going to be affected by something again. So it says impedance will decrease as frequency increases. So the higher my frequency, the lower it costs to do something, or the lower my impedance will be, that's blocking me from doing something, or blocking blocking me from getting the pain relief. So if I see that I'm not able to help my patient by using a certain frequency because it's not overcoming the barrier of the skin, I may want to increase my frequency so that I'm stimulating the right area at the right time. Mm-hmm. The book says over on the right-hand side at the top, all the way over at the top, a frequency range of 1 to 120 pulses per second is sufficient for most therapeutic goals. Purposeful fused contractions occur between 15 and 50. We're going to give you some specific things. Okay? So that's frequency, and that's no, it wasn't phase. Frequency and amplitude. Okay. So phase duration is the third thing we either have abilities over when we're working with this. So phase duration is, let's see here. Trying to see how I explain this. Almost like playing bingo, if you've ever played bingo. So it's similar to that. And here's the sensibility of what I'm talking about. The goal, if I'm using, hang on, let me get to where I'm going. Yeah. The goal, if I'm using, hang on. I'm losing my place. Yeah, there we go. Yeah. So, phase duration. Let's do it this way. Let's make that make sense. So, trying to see if I want to teach it from the end range where you're going to need it, or do I want to just introduce it and slow my way there? Let's go ahead and give you this. Okay. So let's draw a graph again. So our y-axis is going to be amplitude. Remember, that's how much. And then our x-axis is going to be our time. But this time is not measured in, well, I guess it would be measured in 1 second. 1 second would be out there. So phase duration is going to be proportional to amplitude. As one goes up, the other one goes up. So what phase duration is, it's the amount of time my current is available for use. So how long do I have? And we consider 1 second as being infinity with this one. So this isn't going to be the same way like it was with direct current and indirect. It's going to be a little bit different. So on this one, we're considering if it lasts for a whole second, it's almost like infinity. So phase duration and amplitude are directly proportional. As I go further out this way, going toward 1 second, as my phase duration, PD, my amplitude that I need to depolarize a nerve is going to start to go this way. So it starts up here really high. Let's start here. When I have low phase duration, my amplitude is high. But if I have long phase duration, my amplitude is low. So phase duration, I guess it will be inversely. Is that directly proportional? So as one increases, I guess it's inversely proportional. I should say that. It's inversely proportional. So as one of these, as phase duration increases, it's going to reduce the amount of amplitude I need to depolarize a nerve. So the longer my phase duration, the easier it's going to be for me to depolarize a nerve. So phase duration is how long my current is available for use. And it can be, like I say, we can look at a term almost infinite where it stretches all the way out. Which one? The y-axis, amplitude, how much? Okay. So phase duration along with amplitude are two of the three things that are vitally important to depolarize a motor nerve, or not just a motor nerve, any nerve, depolarizing any nerve. So the longer my phase duration is, the less amplitude I'm going to need to depolarize a type of nerve fiber. Okay. So these are things you have to live and experience versus just hear. All right. So let's do that. All right, partner up. You need groups of twos. Groups of twos, partner up. Yes, sir. Huh? No, y'all can. We're gonna stay up here at the table. Y'all don't have to go back there. Yeah, we'll stay here. But y'all can sit. You're gonna want to sit with someone. So you're gonna have to move closer to a person. She's about the business. All right. Okay. So we're going to live out this experience. Give me a second here.